You hear this argument a lot on the NHS and all these excuses, especially one of recent is saying that it's underfunded, or of course the immigration crisis. The problem with their argument is the fact that the NHS budget for the past decade has continuously increased. Another one being the immigration crisis, where they say, well, the immigration crisis is as if they claim that this is just something new, as if to say the shortage problems that you've been seeing is something to do with the immigration crisis. So there lies the problem, because you could go back way before 2004, before the immigration crisis, and you'll see the NHS was faced with the hospital bed shortage problems, the staff shortage problems, and of course the long waiting lists, even dating right back to the 1950s. I can show you an article here, and it shows you that in 1958 you had the long waiting lines. Even in 1965 you can see the cash shortage problem, as well of course the staff shortage problem. So these problems existed even long before Margaret Thatcher was Prime Minister, long before any immigration crisis of 2004 onwards. It's really just this thing where they're using these excuses, and it's been continual. This failure of the NHS has been around, since the 1950s, since its inception, in other words, in 1948. Continuously, every single year on record, you've seen thousands of people being left in neglect. And a lot of people don't understand why it's been inefficient, why it doesn't work. And again, it really all correlates to that of the economic calculation problem. Again, I don't really need to go into that, because the fact that I've covered the economic calculation problem in 2 videos. The failure of the NHS really all boils down to the fact that when the government made it so-called free at the point of use, then of course you would inevitably face quality deterioration. The free at the point of use meant you destroyed the information of profits and losses. Now, prices are signals. They're not, just things, standing in the way from getting things that you want. They're price signals, they're important pieces of information, and you require the information of profits and losses in order to operate something efficiently. Whenever someone says to you that the NHS is not a for-profit system, as if they claim that's a good thing, they clearly don't understand why profits are so important to the operation of basically any system. The inevitability of the free at the point of use. You were going to see the very issue with the healthcare, where doctors would spend less time, fewer time per patient, because they've got the massive big long waiting line to get through. So because they've got a massive big queue of patients to get through, they're spending fewer time per patient, and they're not getting the same quality. And yet those patients may have waited weeks, some may have even waited months just to get their doctor appointment, and they don't really get much out of it. And I've heard stories of misdiagnosis and all the rest of it, which goes to show you that it isn't really that great, so to speak. And I'm not really surprised, because the best doctors had left the NHS because they don't trust the system. The NHS is not the same thing as the doctors and nurses. We're not going to blame the doctors and nurses. The doctors and nurses do the best that they can within the conditions that they work in, and I feel sorry for them. Even long before the pandemic, they would go through a lot of stress, knowing the fact that they have to make sacrifices, as people would sadly lose their life. And that's the inefficiency of the NHS. The system is at fault itself. And yes, there's a management problem, and yes, they started contracting out to private companies, but the fault isn't to do with that of the fact that you brought private companies in to deal with the problem. That's actually helped in some way. The NHS itself has been faced with these problems even long before they brought in the PFI deals. The failure of the system was really all down to government's price controls and the absence of that fierce competition that you would get through the free market model. Now, these other healthcare systems, whether you talk about France, San Marino, Italy, San Marino, as I probably already mentioned, and of course Singapore, they had hybrid healthcare markets. They had strong private sectors. Of course, in the pandemic, they recently, went for the temporary nationalisation. Whether they stick with that or not, it's just another story. Before, having strong private sectors in their healthcare systems were far outperforming the NHS, especially Singapore. It had far cheaper, healthcare costs than the NHS. Now, you're always going to hear people turn around and say to you, because they try to narrow everything down to a question of 2 things, and they always say to you, well, if you don't support the NHS, then that must mean you support that of the American healthcare system, and that's just deeply flawed. If anybody ever says to you that, if you don't support the NHS, that must mean you support the American healthcare system, turn around and say to them that the American healthcare system is nothing at all capitalist. It's a healthcare system that's strongly corporatist, and thanks to all the socialist government interventionism, you saw the healthcare costs spiral out of control. First and foremost, the American Medical Association monopoly of 1904, the overregulation of the private sector in American healthcare, and of course that of the issue of the third-party payer system, which is the middleman. A third-party payer system basically means that it's someone else other than the consumer that gets to determine the costs, and unfortunate as it is to say that the consumer, is taken out of the equation, so the consumer doesn't have the freedom to shop around for the cheaper cost, and it's not a straight transaction. That's the difference between that of a free market model and that of this monopolised system, because in the free market model, the consumer is the king. The consumer gets to shop around for the cheaper cost, for the cheapest provider and who they trust, and of course it's a straight transaction between the consumer and the provider. That isn't how the main American healthcare system operates. There is currently a alternative system running in America right now, known as the direct primary care system, and it's based off the free market model, and it's like a subscription model where you pay a flat monthly or yearly fee and you get everything of access part of that. Get most of your healthcare needs covered, all part of that flat monthly rate or yearly rate fee, and most of the health insurance is removed from most of that because it's unnecessary. The health insurance is only necessary for things that are more urgent, for more urgent needs, such as more serious health conditions. Through the direct primary care system, through that free market model, they were able to reduce the healthcare costs by up to 80 to 90 odd %, and that's currently running in the United States today. Things like minor surgical procedures and bone scans, lung scans, urine testing, strep throat testing, all the rest of that, that's all covered as part of your membership fee, much like how you would pay for a gym membership. You'd pay £35 for a gym membership, but you get everything of access, such as all the equipment, etc. Even an example of Josh Umber, an American physician in the United States, he charges $10 for kids, and of course anywhere between $50 upwards to $100 a month, basically, for depending on age. They get unlimited home visits, work visits, of course office visits, and technology visits, which is basically Twitter, Facebook, Skype, texting, phone, etc. All of that is covered and they get that access. Difference between the NHS, like I say, doctors are spending fewer time per patient because they can't get through every patient, because of the fact that they've got a massive big backlog, whereas the free market model, they're able to spend up to an hour or even longer than an hour with doctors if absolutely necessary, because of the system that it is, and it would place those with more urgent needs first primary, and because it's run by a profit system, motive system, then resources are allocated to the correct parts of the market. You're not faced with these massive big long waiting lines, you get immediate service, you get a higher quality of standard, and like the NHS, the best doctors left it and of course went to that of better healthcare systems. This is another thing that a lot of people don't understand about economics. People just narrow things down to a question of two things. They think it's just a case of you either have nationalisation or privatisation, and they just cut it off there, as if to say all private ownership is the same. It's like saying that, there's no difference between a private sector with strong government intervention to that of a private sector that's under a free market. It's more or less saying that they're the exact same thing when the reality says otherwise. So these people don't understand that there's a massive difference between, the private sector left be to regulate itself in the free market, where it's in the absence of government subsidies, to that of a private sector that's strongly regulated by government, and government enacting these government subsidies. People think it's just a case that what you have is just a black and white picture view of nationalisation as an option, or you have this privatisation and that must mean capitalism. Capitalism means the free market. It does not mean this system that you live under today, where you see private ownership and you see all these government subsidies and you see the strong government regulation. You're always going to hear these arguments where they say, oh well, if we deregulate the economy, all hell will break loose. Just look what happened in the financial crisis of 2008. Again, these people don't understand economics and they don't understand economic history, because a capitalist system rewards success and punishes failure. Again, people don't understand that isn't the system that you're living under. The system you live under punishes success and rewards failure. In other words, it props failure up. A prime example of that is continuing to bail out failure such as the NHS, and it continues to throw money at it like a bottomless pit. I mean, the NHS really is a religious institution. I think the pandemic thing of recent, it really has shown just how religious people are of it. Now, I've not got a problem with people who go out there and clap that of the doctors and nurses. I mean, these people do put their lives at risk even before the whole coronavirus thing, and whether you agree with it or no, that's a whole other issue. They aren't to blame, but the system itself, these type of people who, put on their Facebooks about how we need to protect the NHS, and the NHS is, they glorify it like it's this, golden calf, the golden bull that everybody bows to, and if you dare oppose it, they will abuse you like there's no tomorrow. I mean, there's a lot of people like that. They treat it like it's the be-all and end-all, yet if you were to ask these people about a free market model of healthcare, they couldn't even tell you anything about it. And again, despite the fact that I've just explained to you that the main American healthcare system isn't capitalist, they'll still turn around and say to you, oh, look at American healthcare costs, which goes to show you that it goes in one ear and right out the other, because they don't even pay attention. Because what they've done is they've basically narrowed it down to a question between the NHS, a socialist pile of crap, to something strongly corporatist, all thanks to all the socialist government interventionism. So whenever someone says to you, look, you don't support the NHS, why don't you go and experience the American healthcare costs? See, next time they say that to you, turn around and say to them, okay then, maybe I'll go over to America and I'll try out the alternative healthcare market model based on a free market model called direct primary care, because that is the alternative to the main American healthcare system. They just assume there's an option between two things. They think that what America's got today, and they actually think the United States today is somehow capitalist. And don't ever let somebody tell you that your version of capitalism's never existed. Don't ever let people say that sort of nonsense. Capitalism's existed, alright. Sure, no one said it was anarcho-capitalism of 100%, right? No one ever said that. But to say that free markets have not existed is to stare in the face of, Hong Kong's history, or Singapore's history, or the history of Sweden between 1870 to 1960, and then sit and pretend that they weren't strongly capitalist. Of course they were. As I say, use up all the excuses, and it's been the same excuses over and over and over for decade after decade after decade. It's like the NHS could do no wrong. Honest to God, I mean, the NHS, it wouldn't even matter how bad it gets, right? People will still use up the excuses for it. And that's the problem with it. That's the problem with socialism, because people grow this emotional attachment to the system itself. They don't want to hear anything at all to do with a free market model. And the truth of the matter is, their free at the point of use system is not more affordable than a free market model. It is not. The free at the point of use is basically you paying not just through taxpayers' money, so it's a hidden cost. You're also paying for it through cutting back elsewhere in the economy. What government gives to you cannot give to you without taking from another first, right? And this is one of the things that a lot of people don't get. And it's so true of what Henry Hazlitt had argued. He said that, so many economists today, never let alone people in general, they really don't understand the broken window fallacy. They honestly don't. Most of them are utterly clueless about the broken window fallacy, because it all correlates in many regards to people's view of the free at the point of use, right? It's the same thing. People view this free, the word free, from face value, and even if some of them admit and they say, oh well, it comes from taxpayers' money, and they come out with this excuse and they say, but the person's using it free at the point of use, that's if you completely ignore the fact that in order for them to have that so-called free at the point of use, what happened to their cost of living? Their cost of living was dramatically increased, and it's just like that other thing they say where it's, it's available for everyone. They say the NHS is available for everyone. Who says it is? Who says the NHS is available for everyone? If that was the case, you wouldn't have the massive big long waiting lines. And there's a guy, like I spoke about before, and he goes to, my gym, and he was told to wait 62 weeks just to see about his back. 62 weeks to see a doctor. And there was a recent video, that Russell Brand posted or something about a letter to, Boris Johnson, and he's speaking about it from an emotional perspective, because he's basically going on about Boris Johnson, and he's basically judging Boris Johnson off of his emotional response to the NHS for support, rather than what the NHS is itself. Economics is a study that doesn't give a shit about how you feel. It doesn't care about that, right? Economics isn't a study that you can argue with. You cannot place your emotions and how you feel above what it is in practice, economic reality. That's a bit like saying, well, I feel we should raise the minimum wage, and I feel that the Labour Party would have been better, and I feel that, Labour Party's rent controls would have benefited us all. Economic reality says otherwise, because every time that price ceilings have been put down, such as the rent controls, it resulted in a price shortage problem. What the NHS is faced with is this denial. The denial of its failure and why it's failing, right? People think, no different to the rest of socialism. You've probably heard people saying, oh, but that's not true socialism. Or they say, oh, socialism just hasn't been tried and tested in the right way yet. It's a bit like saying, oh, we just haven't had the right benevolent dictators yet. A benevolent dictator. It's laughable, folk. It's laughable. Because people, and I recently had this argument with someone, people think it's just a case that if you replace those in charge, those in management currently, and change it with people who are somehow just more knowledgeable, just more intelligent, then socialism will work. No, it won't. It's a central planning problem. It's impossible. I'm not in support of the NHS. I'm not in support of the main American healthcare system. I am in support of capitalism, right? There is only one capitalism, and that's the free market system. That for me is the answer. That for me is the solution. And as I say, I reiterate again, doctors and nurses are not to blame for why the NHS is such a failure. The system itself has got such a problem with all the government price controls, the issue with government's intervention. It's anti-competitive. And the way to solve that is moving it towards a free market system.